Let's look at KwaZulu-Natal now. KwaZulu-Natal sitting with regards to the total number of recoveries, 299,994. With regards to total deaths, COVID-19 related fatalities, it is 9,373. And with regards to active cases in that province, 16,256. 16,256 in terms of the number of active cases. So KwaZulu-Natal's healthcare workers have already started with regards to receiving the Johnson & Johnson COVID-19 vaccine. The province's Premier and Health MEC will be part of the first stage of the vaccine rollout process happening at the Prince Mshiyeni Memorial Hospital in Umlazi. It's where we find my colleague Vusi Khumalo. He's live for us there. Vusi, very good morning to you. What's happening where you are?
Good morning, Blaine, as well as to the viewers. Yes, the rollout program of the vaccine from Johnson & Johnson is currently underway at the Prince Mshiyeni Memorial Hospital. Just a while ago, we've seen the Premier of KwaZulu-Natal, Mr. Sihlezi, as well as MEC for Health in the province, Nomakukusmelani Zulu, having a media briefing explaining or giving us an overview of how the rollout program will be managed in KwaZulu-Natal, where they did say that the two sites currently are Prince Mshiyeni as well as Albert Lutuli Hospital. Those currently will be the sites upon which these vaccines and the rollout will be administered here at the Prince Mshiyeni. Currently, as you can see in my background, I'm going to ask our camera lady, Nomhlengubani, just to show you and pen slightly on my right so that you can see the queue of which those are the healthcare workers who are lining up to get this vaccine and jabs so that they can be able to have this disease, to prevent this disease, because these are the frontline workers people who have been out there, helping people, a number of people coming, with the infection of COVID-19. But with me is the HOD of Health in KwaZulu-Natal, Dr. Sandile Shabalala, who's going to tell us about an overview and the program, how it will be rolled out in the province of KwaZulu-Natal, with having Sihlezi, the Premier, as well as Nomakukusmelani Health MEC, having received this jab in the KwaZulu-Natal. Dr. Shabalala, tell us about an overview of how this program will be managed in KwaZulu-Natal, and also let us talk about the numbers. How many do we have, and also how many are we expecting in the near future or in the coming few weeks?
Thank you. Currently, we are going to vaccinate about 10,800 people in the province, in both sites, that is in Albert Lutuli Hospital and Prince Mshiyeni. This is just the one that are going to be done in this phase. After that, in the country, 80 more thousand vaccines will come, then another 80. After that, the National Department of Health will decide how many are going to be distributed in the different provinces. That equitable share we are going to get is then going to be distributed slowly, going to other sites that we have prepared. And therefore, this is the start, after which we are going to be going on, continuing outwardly from eThekwini or from these two centers to other districts.
Well, if you can just explain, because we know KwaZulu-Natal has got a vast area of which is rural, and also some of the healthcare workers who are in far-flung areas such as Jozini or Obonjeni Hospital, as well as St. Benedictine at Nongoma. How will those healthcare workers receive their vaccination or vaccines?
You will remember that before we received the J&J vaccine, we already had our sites prepared. We had prepared for ourselves 91 primary sites, and of those 91 primary sites, some are in the districts that we are talking about, and as such, when the vaccines come, they will be distributed accordingly. We have already calculated the numbers of healthcare workers in each facility. We know how many healthcare workers per clinic, and therefore when a vaccine comes, we will equitably distribute it according to those facilities, transport it to those facilities, and vaccinations will happen in those facilities. After we are done with the healthcare workers, we then will go to the community.
How many are we expecting in the near future?
The calculation we have tells us that healthcare workers in KwaZulu-Natal are more than 163,000. This is including private healthcare sector. We are therefore looking at those numbers. Again, I must mention, we are not looking only at the conventional healthcare workers. We also are looking at the traditional healthcare practitioners. And we are going to add to this 163 and make sure that everybody who is in the front line gets their vaccine. In phase 2, we then will start to consider other essential workers like the teachers, social workers, and all the other people that are non-health. So those are the numbers. As we are going to be increasing the numbers of vaccines, the numbers of people that are going to be vaccinated will increase. Again, you will remember, we are aiming to vaccinate a minimum of 67%, which is what we call the head population that we want to vaccinate. After that, we will continue. The ultimate aim is that everybody who qualifies to be vaccinated in the country must be vaccinated.
Okay, the Premier also talked about some of the myths that are being associated with COVID-19. Is that something that also worries you as health officials or authorities?
I think we must thank the Premier, the MEC, and the leadership generally in the province, because they have addressed those issues. You will remember that there was a myth about the vaccine being associated with 5G, and they have spoken about that. We have had also people saying the vaccine is here to depopulate people. The MEC has spoken about that. We are worried about it, but what we are seeing now is a very positive uptake of the vaccine, and we are encouraging people to continue vaccinating. It is a vaccine like all other vaccines that we've seen in every part. You will remember as well, as a young kid, you had vaccinations, and we also have other vaccines that we are giving. So we are encouraging people to accept this vaccine and be vaccinated. At least we will know that we are going to be safe. But what is important as well, the amount of money we spend on COVID will go down if we are vaccinated and we are safe from the vaccine. Thank you.
Thanks, sir. That's the SOD of Health in KwaZulu-Natal, Dr. Sandile Shabalala, saying that the province has received just about 10,800 vaccine doses in order to to administer to the healthcare workers in the province of KwaZulu-Natal. Well, with that, it's back to you in the studio.
All right, Vusi Khumalo, live for us in Umlazi in KwaZulu-Natal. Thank you very much indeed, sir, for your reporting.